So let us discuss our first question, the gene that is affected in the fibrous dysplasia. So first of all, you should know what is fibrous dysplasia. It is a bone disorder that is characterized by abnormal growth. So there is abnormal growth and there is development of fibrous tissue in the place of bone. So in place of the bone you will see what there will be fibrous tissue. In place of the normal bone you will see the fibrous tissue. So this condition it can weaken the bone. So that could lead to pain, fractures and deformities. So there are different forms of fibrous dysplasia. One is monostotic. The two types are, remember, monostotic and other is polyostotic. Monostotic means single bone is involved. Polyostotic when it affects the multiple bone. Now let us coming back to the gene that are affected in fibrous dysplasia. Remember COL1A1 gene mutation. It is associated with osteogenesis imperfecta. That is a condition that is characterized by fragile bone and frequent fractures. The other is GNAS1 gene. Yes, it is the gene that is associated with fibrous dysplasia. So your answer would be GNAS1 gene that is associated with fibrous dysplasia. The other is APC gene. So remember APC gene, it is associated with APC gene. It is related with polyposis, adenomatous polyposis coli. So that this gene will lead to polyp in the colon. So there will be high risk of colorectal cancer. And the last is SH3B2 gene. Remember SH3B2 gene, it is associated with cherubism. So your answer, the gene associated in fibrous dysplasia, it's remember the gene associated will be GNAS1 gene that is associated with fibrous dysplasia. Coming to the next question, a patient presented with following clinical features: down slanting palpebral fissures, zygomatic supraorbital and mandibular hypoplasia. There is malformation of ears, isolated cleft palate, and class 2 skeleton pattern with increased vertical proportion. So the characteristics, they are associated with syndrome that arise from neurocristopathy. So which of following it will show following features. So your answer will be mandibulofacial diastosis. The other name of mandibular facial diastosis is Tracker-Collin syndrome. So it occurs due to the mutation in the which of following genes. So remember that TCOF1 gene, POLR1C gene, so these mutations disrupt the normal formation of the bone and tissue in the head. So a patient with mandibular diastosis will show facial abnormalities, including underdeveloped cheekbone. So this the cheekbone will be small flattened cheekbone. There is small jaw, cleft palate, and the eyes will be downward and slanting. That's are the feature of Traken-Collins syndrome. So downward slanting palpebral fissure, zygomatic supraorbital and mandibular hypoplasia. Along with that, you will see malformation of ears, severe malformation of ears. All these would suggest mandibular facial diastosis. Other is cleidocranial dysplasia. So this one, the option B, the cleidocranial diastosis, it occurs due to mutation in RUNX2 gene. So which gene is associated with the cleidocranial diastosis? It is RUNX2 gene. So the RUNX2 gene, so in the cleidocranial dysplasia you will see absent collarbone. So this collarbone here is absent. There will be delayed or absent closure of frontalis on skull, short stature. These are the features. Third option is the Crouzon syndrome. So this one is the Crouzon syndrome. Crouzon syndrome, it is primarily caused due to mutation in the gene FGFR2 gene. So which gene? FGFR2, remember that for your exam. So there is abnormal head shape, flat head and prominent bulging eyes. So you can see these prominent bulging eyes. The mid face underdeveloped cause a sunken appearance in the middle part of the face. You can see acrocephaly here, tall pointed head, that's the feature, bulging downward slanting eyes, cleft palate, wide thumb, open fontanelles. Moving to the next question. A patient came with history of sharp lancerating pain on right side of face that is not relieved by analgesic. On progressive symptoms, carbamazepine was found effective in this patient. So what is the most probable diagnosis? In the trigeminal neuralgia, you will see the pain that is sharp, stabbing or lancerating pain. That's the characteristic of pain that is sharp. So the pain here in the trigeminal neuralgia is sharp, stabbing and lancerating type of pain. So the pain, it is triggered by minor stimuli like the touch, chewing, etc. So the medicine given is carbamazepine, available with the brand name Tegretol, Tegravel. So therefore carbamazepine is the drug that is effective in relieving the pain associated with the trigeminal neuralgia. The pain in the acute pulpitis, it presents with the continuous pains. There is continuous pain. So it is the pain in the acute pulpitis, it is continuous and it is not a sharp lancerating pain. Additionally, carbamazepine, it is not the typical treatment for the acute pulpitis. The acute dental abscess, it is a localized collection of the pus within the tooth or in the surrounding tissue. So it can, the pain from abscess, is not sharp lancerating pain. The dry socket is a painful condition after the tooth extraction. Pain here is also not sharp lancerating pain, and it is not relieved by the use of carbamazepine. So answer here would be trigeminal neuralgia. Next question, a 36-year-old female reported with swelling over the right side of face. You can see the swelling that is present on the right side of the lower jaw. The face was asymmetric. The face symmetry. So the face here is asymmetric with a diffuse swelling over the right side of the face. The third molar was clinically missing. On OPG, you will see OPG show a radiopaque, radiolucent lesion on the right side of the mandible with impacted third molar, displaced posteriorly and horizontally. So your diagnosis will be dentigerous cyst. So dentigerous cyst is typically forms around the crown of impacted third molar. So it has so the impacted molar here, it is displaced posteriorly and horizontally. That is the common presentation for the dentigerous cyst. In the cherubism, the swelling is bilateral, as here the swelling is over the right side of face. So in cherubism, there is bilateral swelling, and it appears in the childhood, and the age of patient is 36 years old. So cherubism is not the answer. The myeloblastoma, they can cause expansion of jaw, but they don't typically displace the third molar. The myeloblastoma, they are found in posterior mandible or ramus region. CEOT, it involves the anterior region of jaw, and it does not typically displace the third molar. So that is also not the answer. So your answer here is the dentigerous cyst. So remember, dentigerous cyst frequently involve the impacted third molar. A 50-year-old female presents with oral and corneal ulcerations. Her biopsy specimen reveals subepithelial bulla. What is your diagnosis? Well, your diagnosis will be mucous membrane pemphigoid. So you can see here the oral ulceration along with the corneal ulcerations. So what do you mean by subepithelial bulla? Subepithelial bulla means the presence of cleft or separation in the subepithelial connective tissue. Of the mucous membrane. So beneath the epithelial layer is the subepithelial layer. So in this, the autoimmune attack can affect the proteins that will hold the epithelial layer to the underlying connective tissue. That leads to separation or cleft between the epithelium and connective tissue, where bulla formation can occur. Whereas in the pemphigus vulgaris, there is intraepithelial cleft. That means there is split or separation within the epithelial layer that is over the topmost layer of the mucous membrane. So that split can lead to formation of blisters or bulla, and these blisters may rupture, leading to erosions or ulceration within the mucosa. The next question, a 6-year-old patient, it is referred to you by a dermatologist for dental treatment, or on examination you will see the hypoplastic teeth, scarring caused by trauma from suckling, eating and toothbrushing that results in immobility of the tongue and lips, cracks found at the corner of the mouth and limited mouth opening. What is your diagnosis? So the epidermolysis bullosa, it is characterized by blistering and fragility. So blistering and fragility of the skin and the mucous membrane in response to the minor trauma that is due to the friction. So all these are features of epidermolysis bullosa. A patient came to clinic with a lesion confined to middle of the hard palate. The lesion is fluctuant and tender. So radiographically you see a radiolucent area So radiographically you will see a radiolucent area. This one is the radiolucency between the two central incisors. So your answer will be incisive canal cyst. Remember the incisive canal cyst. It is present between the two central incisors. So your answer is incisive canal cyst. Moving to the next question. A 40 years old male presents with the pain, lancerating pain affecting one side of the throat and base of tongue that is precipitated by swallowing, chewing and coughing. So your diagnosis is would be glossopharyngeal neuralgia. Like as we discussed the previous trigeminal neuralgia, the patient here presents with a sharp, lancerating, electric shock like pain that occurs along the distribution of the trigeminal nerve. However, it does not involve the throat and base of tongue. So it is less likely to be diagnosis of trigeminal neuralgia. The Frey syndrome, it is as a result of damage to the auriculotemporal nerve. So that affects the parotid gland, it causes sweating and flushing on the one side of face. The glossopharyngeal neuralgia, the answer would be glossopharyngeal neuralgia. That is due to the irritation or compression of the glossopharyngeal nerve that affects the throat, tonsil, base of tongue and sometimes the ear. Now what is the cause of glossopharyngeal neuralgia? It can occur either due to the nerve compression, that is the compression or irritation of the glossopharyngeal nerve, or it can occur due to the or it can due to any infection of the throat and surrounding tissue, or that could be due to the lesions or tumors in the glossopharyngeal nerve. A 27 years old patient reported to dental clinic with complaint of burning sensation in mouth, sensitivity to hot and spicy food for last 8 months. She complains of red area of tongue with burning sensation, disappearance of red areas when the burning subside. There is demarcated zone of erythema on tongue with slightly elevated serpentine white borders. So your diagnosis is geographic tongue. So the serpentine borders, snake-like borders, these are the characteristic of the geographic tongue. So in the geographic tongue, it is condition that is transient irregular shape erythema occur on the tongue and that appears and disappears. So it appears and disappears. So there are the red areas that appears and disappears. These red areas, they are surrounded by elevated white areas. So that this condition often causes burning sensation due to consumption of spicy food. Erythematosus candidiasis, it is a fungal infection that present as a red erythematous area on the palate. It lacks the characteristic of white, slightly red serpentine border. So it cannot be your answer. Hydroplakia, it is the red patch that is potentially a pre-malignant lesion. So your answer here will be geographic tongue. A patient presented with small yellow spots that are present bilaterally on the buccal mucosa opposite to the posterior teeth without any associated complaint. So the most common diagnosis of the condition is, so you can see here, these are the Fordyce granules. Those Fordyce granules, these are number one, they are the granules that are present bilaterally. So these granules, they are present bilaterally on the buccal mucosa opposite to the posterior teeth. Whereas the coplic spots, these are the small white or bluish white spots with a red halo that are also seen on the buccal mucosa, but they are seen in conditions like measles, and they are not yellow in color. So they can occur on the oral mucosa, but their coloration is different. The next is the melanotic macule. Melanotic macule, they are the flat brown to blackish. So their coloration of is different. They are present on the skin or mucous membrane and they are not yellow in color. They can occur on the oral mucosa, but their coloration is different. The white sponge nevus, so it is characterized by the white folded or corrugated mucosal patch that are often found on the buccal mucosa. So it is also not associated with yellow spots. So these spots are seen in the Fordyce granules. So these spots are benign and do not cause any symptoms or discomfort. They are considered a normal variation and not a disease. Coming to the next question. Which of following is the difference between the burning mouth syndrome and symptoms of the burning mouth? So the answer is pain occurring in the morning. The burning mouth syndrome, the pain is typically more pronounced in the day, and it often worsens as the day progresses. And it may be least severe in the morning. Whereas the condition a burning mouth, the pain can occur at any time of the day, and it is not necessarily worse in the morning. So that is the difference between the burning mouth and symptom of the burning mouth syndrome and burning mouth. Next question is cell of primary importance in oral lichen planus. Oral lichen planus, we know it is an inflammatory disorder that affects the mucous membrane of the oral cavity. So the cells of primary importance in oral lichen planus are the T lymphocytes. So one of the main characteristic feature of oral lichen planus is presence of saw-tooth retipex. So these retipex, these are in shape of saw or band-like pattern retipex. So this saw-tooth pattern, it occurs due to the infiltration of the inflammatory cells, primarily the T lymphocytes. At the interface of epithelium and connective tissue junction. Along with that, you will see the most important feature is basal cell degeneration. So that means the damage and degeneration of the basal cells in the oral epithelium. There is prominent granular layer, that is this one is the granular layer, that refers to there is increase in number of keratinocytes. With visible granules in their cytoplasm. So this granular layer may be result of increased keratinocytes turnover due to the inflammation process. Now let us discuss why T lymphocytes, they are primarily important in oral lichen planus. T lymphocytes, specifically the CD8 cytotoxic T cells, they are predominant inflammatory cells in the infiltrate of oral lichen planus lesion. So they play a central role. They will cause damage to the basal keratinocytes, so leading to basal cell degeneration and characteristic sawtooth appearance of the retiridges. Other immune cells like macrophages and B lymphocytes, they may be present in the oral lichen planus, but the T lymphocytes, they are the key players in the pathogenesis of this condition. So the most important cells are the T lymphocytes. Next question is preferred for biopsy of the mucosal lesion is exfoliative punch biopsy, incisional biopsy, or excisional biopsy. The preferred method is the incisional biopsy. So incisional biopsy means removal of small piece of tissue. So removal of the small piece of tissue from the affected area. So this method is often preferred for mucosal lichen planus. So this method would provide a sample of the affected tissue and preserving the surrounding affected tissue. Now, what is exfoliative cytology? It means like this one is the surface of the lesion. So these cells are present. So in exfoliative cytology, what we do is we gently scrape the cells from the surface of lesion using a spatula. Or cytology brush. So this lesion is commonly used for the superficial lesions. What is punch biopsy? So this one is example of punch biopsy that involves a small circular punch tool to remove a full thickness sample of tissue from the lesion. What is excisional? What is excisional biopsy? Excisional biopsy involves the removal of the entire tissue, including the surrounding normal tissues. So removal of lesions along with the surrounding normal tissue is excisional biopsy. So it is done for situation where lesion is small, well defined, and when complete removal is necessary for both diagnosis and treatment. So for mucosal lichen planus, one can prefer is the incisional biopsy. Now the lichen planus presents with following histological features. The answer is B. So here you will see epithelial atrophy. That means there is reduction in the size of the epithelial layer. There will be perivascular inflammation. That means that there will be presence of inflammatory cells, particularly the lymphocytes around the blood vessels in the connective tissue. So saw-tooth retipeds, these are the feature of the basal cell degeneration. All these are features of the lichen planus. Which of following is more frequent than other in lichen planus? So buccal mucosa is involved more frequently than the other. So the buccal mucosa, it refers to the one of the it is one of the most common affected site in the oral lichen planus. It is frequently involved, and the lesions, you can see these lesions are like white, lacy or reticular pattern. The tongue may be involved, but it is less commonly affected. It can affect the palate, the lips, but they are less frequent. The most frequent site is the buccal mucosa. Coming to the next question, PAX9 gene mutation explain the etiology of which of following? Remember the PAX9, it is a transcription factor gene. So mutation in this gene will disrupt the normal regulation of the tooth formation that will lead to abnormalities in tooth number and morphology. So PAX9 gene may be associated with all these conditions. The next question is caries promoting agents. So remember the key that is very important for your exam point of view, the caries promoting elements. They are remember the mnemonic. The mnemonic to remember for them is Punjab, Patiala, or Moga. से कुड़ियाँ. So पंजाब, पटियाला, मोगा से कुड़ियाँ. So remember the caries promoting element. So the answer here would be selenium. The definite karyostatic, they are fluorine, phosphorus. The mildly karyostatic, that is vanadium, molybdenum, strontium, boron, calcium. So remember all these caries promoting and having no effect. So the minerals that have no effect are aluminium, barium and iron. The next question is the traumatic tattoo. So the traumatic tattoo, it is also known as amalgam tattoo. So it is a benign oral lesion that is caused by introduction of the foreign material like the amalgam. Into the oral tissue. So the first option, it may appear as a radiolucent lesion. The traumatic tattoo, as we know that it appears as a bluish or greyish lesion. So it will appear as bluish or greyish lesion on the oral mucosa, and it appears not radiolucent, but it appears radio-opaque. So why? Due to presence of amalgam particles. So the amalgam particles make them radio-opaque. Second, usually produces a small local lesion area of necrosis. A traumatic tattoo does not typically result in necrosis or tissue death. It occurs when the small particles become embedded in the oral mucous tissue, but it does not cause tissue death. The third, it has a foreign particle deposited in the connective tissue. So yes, that's true. And last is it has a pathognomic clinical appearance. So like they have a characteristic appearance, they are not pathognomic, meaning they are not unique to specific disease or condition. Other pigment lesions in the oral cavity might have similar appearance. The next question is mutation in the fibrillar gene, one gene, result in second most inherited connective tissue disease that is known as, the answer would be the mutation in the fibrillar 1 gene. It is associated with Marfan syndrome. So remember the mnemonic: M stands for mitral valve prolapse, A stands for aortic aneurysm, R for retinal detachment, F for fibrillar gene, A for arachnodactyly, and N is negative nitroproceed test. So, the other syndromes like Ehlers-Danlos syndrome, it is a group of inherited connective tissue disorder, but it generally affect the genes like COL5A1 and A2. The second is Tickler syndrome. It is another connective tissue disease that is associated with the COL11A1 gene. Alport syndrome is hereditary kidney disease that can affect the glomerular basement membrane. So the answer here would be Marfan syndrome. So remember the mnemonic, that is Marfan's. An easy way to remember things in your exam. Now let us move to another question. The classical features of osteosarcoma are, well, the osteosarcoma, we know it is a malignant bone tumor. So it will seen in bone. So it has a typically what kind of appearance? Sunburst. So that appearance, it is seen on X-rays. So what you will see, there will be presence of X-rays. On X-ray you will see spicules. So these spicules or ray radiating outer toward the tumor, these are the particular properties of the osteosarcoma. So these rays are typically seen in periosteal reaction. So these rays are seen typically in periosteal reaction. That is the body response to tumor growing on the surface of bone. Sometimes it is associated with the widening of the periodontal ligament. So that option is also true. Other is the Codman triangle. So what is Codman triangle? Codman triangle, it is the classical radiographic features that is associated with osteosarcoma. It is a triangular. You can see a triangular wedge-shaped area of new bone formation. So Codman triangle is the new bone formation that would be seen on X-rays. So it is due to the result of elevation of the periosteum by the growing tumor. So answer here would be all of the above. All of the above are correct statement. The next question, a female of 26 years old presented with ulcers, photosensitivity and skin malar rash in face, sparing the nasolabial fold of both sides. So you can clearly see this malar rash. So this malar rash, it is seen in SLE. The first option is Sturge-Weber syndrome. So the Sturge-Weber syndrome, it is characterized by port wine stains, birthmark on the face, involving the upper face and forehead. So it is associated with neurological symptoms and not typically associated with oral lesions, photosensitivity or a malar rash. Other is SLE, that is systemic lupus erythematosus. So it has a characteristic feature of a malar rash, giving a butterfly shaped rash that spares the nasolabial fold. It can present with photosensitivity and ulcers. So remember the butterfly rash. Third, if dermatitis, it is a general term for skin inflammation. It causes skin rashes and it is less likely to cause oral ulcers or photosensitivity. The last is the psoriasis. Psoriasis, it is a condition that is caused by development of thick red scaly skin patch. So skin rashes, it causes skin rashes that is not typically associated with oral ulcers or a malar rash. So your answer would be SLE. Now identify the following syndrome for the given image. So the answer is chondroectodermal dysplasia. It is also known as Alice Van Creveld syndrome. So it is an autosomal recessive syndrome. So it may involve the skeletal system and the ectodermal system. So there would be dental anomalies like the missing teeth, malformed teeth. It may have involvement of. So the chondroectodermal dysplasia, it can affect both the ectoderm and mesoderm component. The ectoderm component, they are the skin, hair, nails, sweat glands, and the mesodermal components are the skeleton tissue. So the key difference between the chondroectodermal dysplasia and ectodermal dysplasia, it lies in the it affects both the chondroectodermal dysplasia primarily affects the skeleton and ectodermal structures, and it is inherited in autosomal recessive manner, whereas ectodermal dysplasia, it affects the ectodermal component. The next question is, dens connatalis is synonym of. So it is a synonym of the neonatal teeth. The other terminology that we use is a denticea precox, dens connatalis, infancy teeth, or terminology we use is precocious dentition. So remember them. Next question, the dens E vaginatus may typically represents the dens E vaginatus and talon cusp. They are both dental anomalies involving cusp-like projections. The dense E vaginatus, it is characterized by extratubercle that appears like a horn-like structure from lingual or labial surface of the anterior teeth. The next is arrhythmia multiforme. It is characterized by target lesions. So it is characterized by, so these are the target lesions. So this one is the edematous ring that is surrounded by a central blister. The Herald spots, they are not typically associated with edema multiforme. They are seen, Herald spots, they are seen in conditions like pityriasis rosea, where a single large scaly patch appears before the development of smaller lesions. Auschwitz sign, it is a clinical disease that is seen in certain skin conditions like it is Auschwitz sign, it is seen in psoriasis. So that represents the pinpoint bleeding spots. The psoriasis represents the pinpoint bleeding spots. So when you remove these scales from the skin, there is pinpoint bleeding. So the defect in cherubism is there is increase in the osteoclast. So it is a rare genetic disorder that affects the bone of jaw and the face. So you will see the abnormal growth of the fibrous tissue. So that can give like a cherubic or chipmunk. Chipmunk faces, they are typical of cherubism. So the underlying cause of cherubism, it is a genetic mutation that leads to overproduction of the osteoclast, in which cells they are responsible for bone resorption, and these overactive osteoclasts leads to resorption of tissue bone in the jaw. So there is a compensatory increase in production of new bone by the osteoblast. So that is why there is characteristic appearance of expanded jawbone. The next question, moving to the next question. The reason for the ground glass appearance in fibrous dysplasia is the fibrous dysplasia. It is a bone disorder that is characterized by replacement of normal bone with a fibrous tissue. The fibrous tissue, it will appear denser on the radiograph. So that gives a ground glass appearance. Or hazy appearance. So the affected bone become weaker and less dense compared to the normal bone. The appearance of the natal teeth, it was given by Habling. So he classified into category 1, category 2, category 3 and category 4. One is a shell-like crown that is loosely attached to alveolus by rim of oral mucosa with no root. Category 2 is solid crown tissue loosely attached to alveolus by oral mucosa, little or no root. And third is the incisal edge of crown just erupted through the oral mucosa. And fourth is the mucosal swelling with tooth erupted but palpable. The last question is next question is the dash is known to occur in association with the Paget's and fibrous dysplasia. So it's the osteosarcoma. The osteosarcoma, it is a malignant bone tumor that can develop as secondary complication in individual with the Paget's disease or previously affected by the fibrous dysplasia after the therapeutic radiation. So your answer will be osteosarcoma. So moving to the next question, the required adult dose of acyclovir in the treatment of severe herpes infection in the herpes zoster, it is, well, the answer would be 800 milligram that would be taken 5 times daily. So this one is the acyclovir tablets in the dose of 800 milligram that can, in the case of the severe cases, severe herpes zoster infection, 800 milligram would be taken 5 times daily. So your correct answer would be 800 milligram 5 times daily. These are the antiviral drugs classification. Remember the anti-herpes virus drugs that apart from the acyclovir that could be given in the case of herpes zoster infection. Moving to the next question. The following figure shows typical intraepithelial clefting with a tombstone appearance of the basal cells, showing acantholysis with the formation of Zank cells in the epithelial cleft. So these are the microscopic features of. So remember the features of pemphigus vulgaris. Number 1, intraepithelial clefting, tombstone appearance of the basal cells, suprabasilar split, acantholysis, and formation of the Zank cells. Now, what is intraepithelial clefting? So, intraepithelial clefting means separation of the epidermal layers within the skin. So, when the epidermal layer it gets there is separation, it will be seen as intraepithelial clefting. So in the pemphigus vulgaris, what you will see, there will be suprabasilar split, means the separation it occurs. The separation it occurs above the basal cells. And remaining basal cells may appear like tombstone. So acantholysis, it is the loss of the intercellular connections between the keratinocytes in the epidermis that leads to the blister formation. Other important feature is the Zank cells. Zank cells, they are the multinucleated giant cells with these are the multinucleated giant cells that can be seen in the blister fluid. Other option like NUG, it is a form of gingivitis involving the ulceration and necrosis of the gum tissue. Erythema multiforme, it is a skin condition that is characterized by the erythema multiforme. You will see the target lesions. Lupus erythematosus, it is an autoimmune disease that can affect the skin, leading to various skin disorders. So answer here would be the pemphigus vulgaris. Moving to the next question, which of following is not seen in the cherubism? Cherubism, well, it is a rare genetic disorder that it primarily affects the jaw bones and facial features. So the cherubism, it typically begins with the bilateral overgrowth of the mandibular condyles that lead to chubby appearance. So chubby appearance or uh, chubby cheeky appearance in the affected individual. Other important feature is the eyes that is moved toward the heaven. So you can see the eyes, they are upward, moved in the upward direction. So your answer is absence of growth over condyle over both initially. So there is not absence of growth over both condyle, but there will be bilateral overgrowth of the mandible condyle that would lead to cherubic or chubby appearance in the affected individual. So also remember for your exam point of view, what is the gene that is associated with the cherubism? It is SH3BP2 gene that is associated with the cherubism. That's very important for your entrance exam point of view. The next question, the tetrad for the etiology factor for the caries does not include, hygiene is not typically included in this tetrad. It consists of time, tooth, substrate. So this is the caries tetrad. Next question, moving to the next question. What is the appearance of X-ray picture of the Paget's disease? So it's a cotton wool appearance. So this condition, the cotton wool appearance, it represents the cloudy appearance, cloudy or mottled appearance seen on X-ray due to the increased bone density. So there will be increased bone density, that is radiopacity, but that cannot be the option, but the characteristic feature is the cotton wool appearance. So we will mark the cotton wool appearance as answer. So there will be mottled appearance, there will be increased bone density and disorganized bone structure that would be seen. You can see a cloudy appearance that gives characteristic like Paget's disease. So other mnemonics just to remember the Paget disease is PAGET. P stands for polyostotic, A for there is increase in alkaline phosphatase level, G for the giant cells that are present, osteoclasts with many cells, there is enlarged bone, the bone get expanded, there is thickened skull bone including the frontal, parietal and the occipital, and there may be skeleton pain and deformity. So remember this mnemonic for your entrance exam point of view. Now next question, moving to the next question, if the number of teeth that are 6 in oral cavity, it is classified as what kind of hypodontia? So remember the terminology, 3 terminology are there: mild hypodontia, moderate hypodontia and severe hypodontia. So if involvement of 1 or 2 missing teeth in the oral cavity, it will show mild hypodontia. If there is 3 to 5 missing teeth in oral cavity, it is moderate hypodontia, and severe hypodontia involves the 6 or more teeth missing. So the answer is very severe hypodontia. Oligodontia is a rare condition that represents the missing of more than 6 teeth. That is important for your exam point of view. Next question, the Cobb-Day shaper near the midline of face, contralateral Jacksonian epilepsy, trigeminal neuralgia, ocular finding. These are the features of. So the answer would be Perry-Romberg syndrome. So there will be in Perry-Romberg syndrome, but you will see there will be atrophy of one side of face. So that can this atrophy can result in various features like Cope de Saber. So that means there is a linear depression lesion near the midline of face. So Cope de Saber, it means that there is a linear or vertical depression or lesion on the skin or the face or forehead. So that may gives appearance of sword strike. Apart from that, there is contralateral Jacksonian epilepsy. That means that the epilepsy that occurs on the opposite side of body, contralateral to the side affected. So in Jacksonian epilepsy, the seizures begin in specific area of the brain and then they spreads to the adjacent areas. That leads to the Peri-Romberg syndrome. So answer would be Peri-Romberg syndrome. Moving to the next question, to obtain a better informative radiographic view of cyst which has eroded the cortex considerably, to obtain a better informative radiography view of cyst, the cortex, you should consider the voltage that should be increased. Now, what will be the effect of if we keep the voltage increased? So, increasing the voltage, that means increasing the kVp, kilovoltage, that will give higher energy X-ray beam. So, that will provide a higher energy X-ray beam. So, this higher energy beam would penetrate the denser tissue more effectively. So when cyst which has eroded the cortex considerably, it may result in increased opacity or thickness in the area, so making it more difficult to visualize on X-ray image. So by increasing the voltage, you can produce X-ray with greater penetration power. So the answer would be the voltage should be increased. The next question is the hallmark of adenoid cystic carcinoma histologically is. So remember the histological features of the adenoid cystic carcinoma. There is tubular and cribiform pattern, perineural invasions, sphestoid cells, myoepithelial cells, hyalinized stroma, infiltrative growth, and perivascular growth. So these, so you can see here is the tubular and cribiform pattern. So the adenoid cystic carcinoma, it is a malignant tumor that occurs most commonly in the salivary glands, in the major and minor salivary glands. So the most important structures or the pattern that would be seen is the tubular pattern or cribiform pattern that gives appearance of cheese-like appearance with the cystic species. Although adenoid carcinoma demonstrate a unique property like perineural invasion, so where the tumor cells, they will invade and surround the nerve fibers, that can make the complete surgical procedure challenging. So the most important features is the typical basaloid cells. So these basaloid cells, they have a dark staining nucleus and minimum cytoplasm. Apart from that, there are myoepithelial cells. These cells, they have ability to contract. So these myoepithelial cells can contract and they are involved in the formation of ductal structure within the tumor. There is hyalinized stroma that makes it becomes dense and it appears glassy in appearance. Other is the perivascular growth. You can see is where the tumor cells, they wrap around the blood vessels. So your answer would be the hallmark of adenoid cystic carcinoma is basal cells which form cylinders. Although perineural invasion is seen, but the suitable answer would be basal cell that forms the cylinder, that is the hallmark of the adenoid cystic carcinoma. The next question, the cyst that is formed by cystic degeneration of enamel organ, it is the primordial cyst. Remember, the primordial cyst, it is a developmental odontogenic cyst that is formed from the remnants of enamel organ after the tooth development. So your answer would be primordial cyst. Cyst that arise from the degeneration of stellate reticulum is, it is again the primordial cyst. Remember that for your exam point of view. The cyst that is present on the medial raphe of the hard palate and appears to be arise from entrapped epithelial remnants, it's the Epstein pearl. Cyst. So what Epstein pearls? They are small whitish cyst that appears on the gum along the roof of in the mouth in the newborn and infant. So they are often caused by trapping of the epithelial cells during the development of the mouth. So they are usually harmless and they tend to resolve on its own. Other are the Bohn dews. They are small keratin-filled spaces that can be found on the buccal and the lingual mucosa, and they are thought to arise from the salivary gland tissues. So answer would be Epstein pearls. Next question, the most potential, aggressive and destructive cyst that causes hollowing of the mandible. So answer would be dentigerous cyst. So the important mnemonic to remember the dentigerous cyst is, remember this mnemonic. Number 1, it develops around unerupted supernumerary crown teeth. The epicenter is just above the tooth crown and attached to its manto-enamel junction. No pain or discomfort, often discovered due to the missing teeth. Typically has a well-defined cortex. Internal aspect, it is radiolucent. It has great potential to displace and dissolve the adjacent teeth. Effect on the surrounding tissue. Radiographic appearance show complete radiolucency, that is attachment to crown. Often seen around maxillary, third molar or canine. Unerupted teeth, enclosed by cyst leading to the throw growth. So remember all these. The mnemonic, very important mnemonic, dentigerous cyst is the most examiner's favorite questions that they generally ask in the entrance exam. Next question, bluish blackish cyst appears on the maxillary and mandibular ridge of newborn. That is the dental cyst of newborn. These are the small benign cysts that can occur in oral cavity just after the birth. They are bluish color, commonly found on alveolar ridges of jaw of the maxilla. So these cysts result from the remnant of the dental lamina. So dental lamina cysts, they are normal findings in newborn and generally resolves on its own. Moving to next questions, the dense E. vaginatus, it is common in these peoples. So the dense E. vaginatus, it is more commonly found in certain population. So it is most common in Mongoloids and Southeast Asian population. So it is most common found in Mongoloids. The dense E. vaginatus, it is common found in the Mongoloids, which include people of Asian descent. So answer would be yes, Mongoloids. Moving to next question, which of following nerves it is associated with the Sturge-Weber syndrome? So the nerve associated with the Sturge-Weber disease is the trigeminal nerve. So remember the mnemonic. So this syndrome disease is associated with port wine stains. So port wine stains at present at the birth. The birthmark on the face, which is typically in the distribution of ophthalmic division of the trigeminal nerve. Which nerve? Trigeminal nerve. So remember the mnemonic NEVUS. And N means neurological involvement in the disease. It can be episcleral and ocular. Vascular malformation involves the V1 trigeminal distribution. That was your answer. Along with that, there is unilateral leptomeningeal angiomatosis, seizures and stroke-like episodes. So remember this mnemonic, the NEVUS. The next question, Beckwith hypoglycemic syndrome include all, except there is mild macrocephaly. There is microcephaly. Apart from that, there is macroglossia, microcephaly and umbilical hernia. So these are the features of Beckwith-Weidman syndrome. So your answer would be mild macrocephaly. Instead, there is macroglossia. And it is mild microcephaly. Moving to next question, the form of lichen planus that undergo malignant transformation, it is most commonly the erosive type. So most common form of lichen planus, if you remember for your exam, it is a reticular form that shows become stripe. The most likely to undergo malignant transformation, it is erosive type. So answer is erosive type. The present with the blistering lesion, it is bullous lichen planus, and present with the hyperkeratotic plaque, it is hypertrophic lichen planus. So remember all these. The next question, the 23-year-old lady, it develops brownish pigmentation on cheek and bridge of nose on exposure to sun. So that is closisma. So remember the condition here is you can see here it is the brownish. Typically there is brown discoloration of the skin. So that that is characterized by hyperpigmentation patches on face, especially in areas that are exposed to sunlight. So there will be brown, tan patches. On the cheek, nose, forehead, and the chin. Other options like photodermatitis, SLE, rosea, they can also involve the skin, but the specific pattern of the pigmentation described it is consistent with the glaucoma, as it worsens with the sun exposure. The next question, the natal and neonatal, they are occasionally seen in, they are most common in the mandibular incisors canine, but they are sometimes they are occasionally seen in maxillary incisors. So remember the word occasionally. So examiner has, sometimes you may get confused with the question and mark mandibular incisor, but yes, they are most common. The question here is occasionally seen in. So your answer is A, maxillary incisors. Moving to the next question. Biopsy of gingiva in the lichen planus will show bands like infiltrate of lymphocytes. We have discussed them already. So remember the mnemonic. The important is the mnemonic. The mnemonic is oral lichen planus. So oral lesions, it has a whitish or greyish velvety lesions, appears bilaterally, posterior buccal mucosa involvement is there. R stands for reticular pattern. The pattern is reticular. There is reticular arrangement of lesions. Age group affected are middle age individual. L stands for lace-like appearance, presence of Wickham stria, lace with the tiny white elevated dots. So the lesions are keratotic, erosive, vascular, and atrophic lesions. On immunofluorescence, you will see fibrinogen at the basement membrane. That is important criteria. C stands for cutaneous presentation, like there is violaceous papules forming plaques. On histopathology, you will see hyperkeratosis, sawtooth, retipex. We discussed that in a previous question. There is liquefactive degeneration of basal cells, eosinophilic bands, and dense subepithelial infiltrate. Erythematous gingiva, thread-like appearance. Common site of involvement is buccal mucosa. Lesions can be linear, annular, or retiform in appearance. Lesions may appear as interconnected lines or Wickham stria. White dots may be seen. So the mnemonic is oral lichen planus. Remember that for your exam, things are very, very easy with the mnemonic part. To remember them and learn them. Next question, majority of the oral hemangioma, they are located on, yes, the majority of the oral hemangioma, they are located on the tongue. So most oral hemangioma, they are located on tongue. Other site of occurrence is lips, mucosa, etc. In osteogenesis imperfecta, you will see, so the osteogenesis imperfecta, it is a fragile and there will be fragility and porosity of the bones with proneness to fracture. So which collagen is defective? It's type 1 collagen, not type 3 collagen. So there is extreme fragility of bones that occur. That is the correct answer of choice. Fracture does not heal readily. That is incorrect. Infected individuals show blue sclera. Yes, they show blue sclera, but that is not the characteristic feature of this disease. There is extreme fragility of bones that occur, so that is the main answer here. The blue sclera is the common but not the universal feature of it. So it is often seen, but it may not be present in all of the cases. Moving to next question, a patient reported to clinic with complaint of restricted mouth opening. On palpation, fibrous band-like structures were noted bilaterally on the buccal mucosa. What is your diagnosis? Your diagnosis would be oral submucous fibrosis. It is due to the areca nut chewing. So, what is oral submucous fibrosis? It is a chronic condition that presents with the patient feels difficult to open the mouth. There is limited and restricted mouth opening. The term we use is trismus. Along with that, there is burning sensation of the oral mucosa. Fibrous bands or strings, they may be palpable in the buccal mucosa, and it is strongly associated with the consumption of this areca nut and betel quid. Moving to the next question, a 30-year patient complaints of cough, was Mantex positive. Medical treatments was started. Patient reported back with complaint of burning and tingling sensation after 2 months of medicine course. Which of following medicine is responsible for the tingling sensation? The most likely reason for the tingling sensation is the pyridoxine deficiency due to the use of isoniazid. So remember, isoniazid is a medication commonly used in treatment of tuberculosis, and it is known to deplete the body vitamin B6, that is pyridoxine. So with the loss of pyridoxine, one would see what thing? There would be neurological symptoms. That is peripheral neuropathy that may manifest as tingling or burning sensation. Other tuberculosis drugs like ethambutol, rifampicin, they also have side effect. But this tingling sensation is most commonly with the isoniazid deficiency. Okay. Next question, outbreak of salivary glands duct. They are known as, remember, it is known as diverticuli. So diverticuli, these are the small pouches or out pockets that form along the salivary glands. So these diverticuli can occur as a result of factors like inflammation or injury to the ducts. The other term aberrancy, it means something that is deviating from normal or expected course. The term second is atresia, that means complete closure or absence of normal opening or passage in the body. The last term, sialodokitis, that means the inflammation of the salivary duct. So the inflammation of salivary ducts is sialodokitis. Next question, histological fibrous dysplasia does not show. So it doesn't show the fibrous encapsulation. Instead, it is characterized by a replacement of normal bone with fibrous tissue and woven bone with a fibrous stroma. So these are the histological features. There is fibrous stroma, osteoblastic creaming, ground glass appearance, cellular fibrous tissue, lack of maturation, and osteoclast like giant cells. So identify the pathology. You can see these lipids. So these are the lipids. So these are associated with which disease? It's van der Waals syndrome. So here in the van der Waals syndrome, you will see lipids, small depressions. They are bilateral that occurs on the both the side of the lower lip that are seen in van der Waals syndrome. The next question: the key triad of dental caries, which factor is known as resistance force? So remember the tooth surface in key triad, the tooth surface is known as resistant force. By attempt to remineralize and resist the demineralization that is caused by acid producing microorganisms and the dietary carbohydrates. So key cycle involves the substrate, flora, tooth, and a fourth factor is sometimes the time. Moving to next question, a patient present with endocrinopathy, fibrous dysplasia of the bone and hyperpigmentation. The most common diagnosis is, your diagnosis will be MC-Kuhn-Albright syndrome. So that the MC-Kuhn-Albright syndrome includes the fibrous dysplasia, cafe-au-lait, spots, and precocious puberty. So cafe-au-lait, spots, these are the hyperpigmentation on the skin that are also described as coffee with milk colored spots. So endocrinopathos, hormonal abnormalities that can include precocious puberty, hyperfunctioning of various endocrine glands that can occur. There is polyostotic fibrous dysplasia and cafe-au-lait spots that are the characteristic features in this MC-Kuhn-Albright syndrome. Remember, this is due to the mutation in which gene? GNAS gene. Other options: Addison disease, it is the primary adrenal insufficiency disease, that is order of the adrenal glands, when the glands does not produce enough hormones, particularly the cortisol and aldosterone. So that could lead to symptoms like fatigue, weakness, weight loss, low blood pressure, and hyperpigmentation. So hyperpigmentation, it is a feature of Addison disease that is not typically associated with the fibrous dysplasia of the bone. This Lenz syndrome, it is also known as colorectal. So here you will see colorectal cancer. Moving to the next question, the desmoglein antibodies, they are seen with the pemphigus. So pemphigus, we know it is an autoimmune disorder, blistering disorder, where body produce antibodies, autoantibodies against desmoglein 1 and 3. So these antibodies and autoantibodies will disrupt the normal adhesion between the skin cells, leading to formation of blisters. So with which variation coronal morphology, if the dense E vaginatus associated, there is shovel-shaped incisors. So the shovel incisors, the lingual surface of the tooth here, it is concave, creating a shallow depression that is known as a shovel-shaped appearance. Apart from the maxillary lateral incisors, which other tooth is commonly affected by microdontia? The isolated microdontia, the maxillary lateral incisors is most commonly frequently affected, followed by the third molars. The reason for endocrine abnormality associated with the fibrous dysplasia, it is due to the overproduction of the mutation in the gene GNAS1 gene. So there is overproduction of CAMP that disrupt the normal cellular signal pathway that leads to fibrous dysplasia. Vicum stria, they are seen in the Vicum stria. They are seen in the reticular form. The reticular form consists of slightly elevated fine whitish lines that are known as Vicum stria. So remember, reticular form, it is the most common form of the lichen planus. The white radiating lines seen on the buccal mucosa is feature of oral lichen planus. Trotter syndrome involves the nasopharynx. So the Trotter syndrome, it is caused by the nasopharyngeal tumor. The patient will have symptoms like pain in lower jaw, tongue, associated mid-ear deficiency. So the cause of pain is due to involvement of the mandibular nerve in the foramen ovale. So Trotter syndrome, it involves the nasopharynx. The histogenesis of pleomorphic adenoma is the pleomorphic adenoma. It also known, it is the most common tumor. It originates from the myoepithelial cells. And ductal epithelial cells. So these the myoepithelial cells, they play a role in histogenesis of pleomorphic adenoma. Next question. Erosion is irreversible loss of tooth substance by a chemical process that does not involve the viruses. So this one is the erosion. So in erosion there is dissolution of the tooth minerals, primarily the hydroxyapatite, that is caused due to the acidic substance. The erosion does not include viruses. It is associated with the acidic substance from the various sources like acidic food, acidic reflux. In case of acidic reflux, extrinsic or intrinsic acidic factors. Bacteria, they can produce acid. Saliva, it plays a protective role by neutralizing the acid and providing some degree of protection. And tissue fluid, they can be involved in the erosive process, as they can transport acidic substance to the tooth surface. Trigger zones, they are absent in sphenopalatine neuralgia. The post-herpetic neuralgia can be differentiated from trigeminal neuralgia by history of recent vesiculation. The post-herpetic neuralgia, it is typically associated with a history of recent vesiculation, as it occurs as the complication of herpes zoster. that is characterized by painful rash with vesicles, whereas the trigeminal neuralgia does not involve skin lesion or vesiculations. Multiple sclerosis, it is autoimmune inflammatory disease of the central nervous system that is characterized by demyelination of the nerves. The multiple sclerosis, it is characterized by demyelination of the nerves in the central nervous system, that is the brain and the spinal cord. So this protective myelin sheath surrounding the nerve fibers, it is damaged or destroyed. That can lead to multiple sclerosis. Smoker's melanosis is indeed a reactive lesion. So it is a type of pigmentation that occurs in people who smoke. So it is considered a reactive lesion because it occurs as a response to chronic exposure of the oral mucosa to components like tobacco, smoke. So moving to the next question, in the caries, which structure becomes more pronounced? So the answer would be stria of Fredgius. The stria of Fredgius, they are the series of band in the tooth enamel that represents the growth pattern. So they are typically less prominent in healthy enamel. However, when the dental caries occur, the enamel structures can be affected. So the caries will cause demineralization and dissolution of enamel, leading to white spots. So as caries progress, the enamel structure is disrupted, and this stria of Fredgius, they are more pronounced or evident. So that is evident of the caries, visual indicator of caries, of the enamel demineralization and damage due to the caries. So the other structures like Hunter's sugar bands, they refers to the alternate light and dark bands in the dentine, while enamel line of Pickerley and stria of Wickham, they are not term used in dental caries. So here the answer would be stria of Fredgius. Moving to next question. Typical histological feature of fibrous dysplasia. So the typical feature is C-shaped trabecally. So fibrous dysplasia, it is a benign bone disorder that is characterized by there is replacement of normal bone with the fibrous tissue. So the fibrous dysplasia, it shows C-shaped trabecally or curvy linear strands of woven bone within the fibrous tissue. The jigsaw puzzle, remember, it is something that is seen in the jigsaw appearance, it is seen in the Paget's disease. So in the Paget disease, there is a mosaic or jigsaw puzzle due to the disorganized arrangement of the bone tissue that gives a jigsaw puzzle. The starry sky appearance, it is seen in the case of Burkitt lymphoma. So there is abundant dark stained lymphocytes that resemble stars on background of pale staining macrophages. The cart and the wheel appearance, it is seen in case with the multiple myeloma. So your answer would be C-shaped trabeculae. The next question, the Mount and Hame, according to the Mount and Hame-Gary's 3.3 would indicate, so this is 3.3 and it indicates the cervical area that is enlarged. So this one is the size and this one is the site. A patient diagnosed with hypocalcification type of amelogenesis imperfecta, the treatment of choice for aesthetic correction of teeth is, yes, it is anterior. The option would be anterior laminates and posterior ceramic full crowns. So the treatment is the anterior laminates. When the front teeth are more affected, improved, patient require improved aesthetic, while the posterior teeth, they can be restored with the ceramic full crowns for the durability. Starting calcium orally before any treatment, it is not a direct treatment for amelogenesis imperfecta, but may be considered as part of overall management plan to promote the healthy enamel development in growing individuals. A polyp may arise in a connection with a polyp. It is a localized reddish mass of hypercalcified tissue in carious teeth. It is seen in cases with chronic open pulpitis. So in chronic open pulpitis, the tissue is exposed to oral cavity due to caries and result a pulp tissue. It can proliferate and forms a polyp-like growth. So that is, this condition is associated with the long-standing irritation and inflammation of the dental pulp. Next question, the saw-shaped retipegs. So these are the saw-tooth retipegs seen in the cases with the lichen planus. So the saw-tooth retipegs refer to appearance of elongated and pointed ridges that are the extension of epidermis into the underlying connective tissue seen in histological examination. So the finding is characteristic of lichen planus, a chronic inflammatory skin and mucosal condition that affect with so your answer would be lichen planus. Apart from that, cavate bodies, they could be also seen. We have discussed this question previously too. So remember the histological appearance. The next question, if the stones they are present in salivary duct, they are chances of metaplasia of lining of salivary duct. So remember the stones in excretory duct of salivary glands. The presence of stone, they can irritate and damage the lining of duct, leading to metaplastic changes, where the normal secretory columnar epithelium, it may be replaced by a non-functional stratified squamous epithelium as a result of injury caused by the stones. So your answer would be metaplasia of lining of salivary ducts. So gene associated in cherubism that we have discussed earlier too. The mutation is in SH3BP2 gene leads to cherubism. So remember that for your exam point of view. Next question, the acinic cell carcinoma are most common. They are most common in the parotid salivary glands. So acinic cell carcinoma, it is a malignant tumor that commonly originates in the parotid salivary glands. The burning mouth syndrome is best described as the burning mouth syndrome is a condition that is characterized by burning sensation in the mouth that does not have any detectable or identifiable cause, such as oral infection or other visible abnormalities. So there is persistent, painful burning sensation in the mouth, tongue, lips, or palate. So your answer is the no detectable oral changes. The commonest teeth that involved in transposition is it is first it is canine and first premolar. So you can see transposition means change in the position. So canine should be here and premolar should be here, but in transposition there is shift in the position. Which of following shows the highest occurrence of supernumerary teeth? The highest frequency of supernumerary teeth is seen in the maxillary permanent dentition, particularly in the anterior regions such as the maxillary incisors and premolar. So this is the area where most supernumerary teeth are found. In taurodontism, you would see the pulp chambers, they are small. The teeth will be elongated. So in taurodontism, you will see elongated small pulp chambers and short roots. The histological difference between fibrous dysplasia and ossifying fibroma is difficult, but the lesion can be distinguished on the basis of it can be diagnosed on basis of a combination of clinical, radiographical, and histological evaluation. So that will help to assess the nature and pain of growth. So that these factors would help in making an accurate diagnosis between the two conditions. The osteogenesis imperfecta defect lies in it is due to the type 1 collagen. That is the major component of bone and connective tissue, and its abnormality or deficiency leads in abnormal collagen production that results in fragile bones and other connective tissue abnormalities. So your answer would be collagen type 1. A 60-year-old patient, Ramesh, has X-ray as expansile solitary tumor in the center of metaphysis with endosteal scalping and presence of punctate calcification. The likely diagnosis would be the chondrosarcoma. It is the most common primary malignant tumor of the bone. It arises in the age of 50 to 60 years. The likely diagnosis for a 60-year-old patient with expansile solitary tumor in the center of metaphysis with endosteal scalping and punctate calcification is chondrosarcoma. Next question, false about cherubism is all of following are true except it is unilocular. Well, it is a multilocular radiolucences that could be seen, not unilocular. The other options, bilateral, symmetrical swellings, presence of giant cells, delayed eruption of permanent teeth, all are characteristic feature of the cherubism. Next questions, which of following Zhang cells is positive? So Zhang cells, it is a simple rapid diagnostic test that involves the microscopic examination of the cells scraped from skin lesions for the presence of multinucleated giant cells. So these are seen in herpes simplex infection. So Zhang cells are useful for diagnosis the herpes simplex infection. It is not typically used to diagnose conditions like zoster, epiphthomatitis, or infectious mononucleosis. What is the known characteristic of Eagle syndrome? So Eagle syndrome, it is a condition characterized by there will be elongation of this styloid process in Eagle syndrome. That would cause a severe stopping pain in the tonsillar region. So, elongation of styloid process or calcification of stylohyoid ligament in the throat can lead to this syndrome. So the pain, it is typically relieved when jaw is open and not when it is closed. So option D is known characteristic of Eagle syndrome. So when the teeth, they are joined at cementum, it is concrescence. So this image represents the concrescence. Next question: cellography of normal salivary glands appear as this, in the cellogram, a contrast agent it is introduced into the salivary duct, and the resulting image show a branching pattern resembling a branch of leafy tree. So, which is characteristic of healthy, normally functioning salivary glands. So, a normal salivary glands would show a leafless tree appearance. The maximum incidence of developmental defect they are seen in the permanent incisors. The patient suffering from complaint from Paget disease, so the most common presentation of a patient suffering from Paget disease is the bone pain. The most common pathogenesis of aneurysmal cyst is failure. The aneurysmal cyst, they are believed to result from local vascular distribution, from local vascular disturbance or trauma. It is thought that after an injury such as minor trauma or surgery, a blood clot forms within the bone that fails to organize properly. So that can lead to formation of cystic lesions with characteristic blood-filled spaces within the bone. So option C is correct. Which of following can lead to irreversible pulp injury? Well, an anesthetic that contains high concentration of vasoconstriction, like the epinephrine, they can lead to irreversible pulpal injury if they are if used improperly. So vasoconstrictor, they are added to anesthetic to prolong their life and reduce the bleeding during the dental procedure. So however, if the excessive amount of anesthetics with vasoconstrictor they are injected, that can cause reduced flow to the pulp that can cause ischemia and could lead to irreversible damage to the dental pulp. The other options like use of sharp burrs, appropriate preparation depth and ample air and water coolants, they are measures taken during the dental procedure to minimize the pulpal injury. So your answer will be A. So this was all about your first OP test. The solutions and video part of the second OP test would be available soon.